Welcome to our channel. Get ready to discover the 8 miracle nutrients for maintaining healthy kidneys. If you're concerned about your kidney health, you're in the right place. In this video, we'll explore the essential nutrients that can make a world of difference in supporting your kidneys. According to the National Kidney Foundation, having chronic kidney disease changes your need for some nutrients. Some of the reasons are the waste products that build up in your body each day can change the way your body uses vitamins and minerals. Some of the medicines you take can change the way your body uses certain vitamins and minerals. Some vitamins are lost during dialysis treatment if you are on dialysis. Following a special diet for chronic kidney disease can mean you miss certain vitamins and minerals from foods. On days when you may not feel well enough to eat regular meals, you may not get enough daily vitamins and minerals. Make sure to stick around to the end to learn how these nutrients can improve your overall kidney function and why most people are missing at least one of these nutrients. Let's dive in. Number 8, vitamin C. Vitamin C is vital for kidney health as it strengthens the immune system and shields against oxidative stress. As a potent antioxidant, it combats harmful free radicals, lowering the risk of kidney damage. Moreover, vitamin C boosts iron absorption, crucial for healthy red blood cell production. By supporting kidney function and immune health, vitamin C maintains optimal kidney health and guards against kidney diseases. Additionally, it promotes the health of various tissues, accelerates wound and bruise healing, and aids in infection prevention. Number 7, vitamin D. Vitamin D is essential for kidney health as it helps regulate calcium and phosphorus levels, crucial for strong bones and overall kidney function. Adequate vitamin D intake reduces the risk of kidney disease progression and complications. The recommended daily intake of vitamin D is 600 to 800 IU for adults. Good food sources include fatty fish like salmon, tuna, and mackerel, fortified dairy products, egg yolks, and fortified cereals. Ensuring sufficient vitamin D intake is vital for maintaining optimal kidney health and preventing kidney-related issues. Number 6, vitamin B. B-complex vitamins are grouped together, but each has a different job to do. One of the important functions of vitamin B6, B12, and folic acid is to work together with iron to prevent anemia. If you have anemia, it means you do not have enough red blood cells. Red blood cells carry oxygen from your lungs to all parts of your body. Vitamin B6, B12, and folic acid are essential for kidney health and can be obtained from various food sources. Vitamin B6, also known as pyridoxine, is found in poultry, fish, salmon, and tuna, bananas, potatoes, avocado, spinach, and sunflower seeds. Vitamin B12, or cobalamin, can be sourced from beef, liver, shellfish such as clams and oysters, fish, salmon, and trout, fortified cereals, dairy products, and eggs. Folic acid, also known as folate, is abundant in leafy greens, legumes, asparagus, avocado, citrus fruits, Brussels sprouts, and fortified grains and cereals. Additional B vitamins called thiamine, riboflavin, pantothenic acid, and niacin can also be given as a supplement. These vitamins help to change the foods you eat into energy your body can use. Number 5, calcium. Calcium is crucial for maintaining kidney health as it helps regulate blood pressure, supports nerve function, and ensures proper muscle contraction. Adequate calcium intake can prevent the formation of kidney stones by binding with oxalate in the digestive tract, reducing its absorption and subsequent excretion through the kidneys. Additionally, calcium plays a vital role in bone health, which is important for overall kidney function. Calcium, along with vitamin D, helps to keep your bones healthy. According to the American Kidney Foundation, it is important to take only the amount of calcium prescribed by your healthcare professional or kidney dietitian. Too much calcium can clump together with phosphorus and deposit in places such as your heart, blood vessels, lungs, and other body tissues. If your blood phosphorus level is too high, you may need to take a medicine used to bind the phosphorus from your food. Some phosphorus binder medications contain calcium. They can give you extra calcium if you need it. Number 4, iron. Iron is essential for kidney health as it supports the production of red blood cells, which transport oxygen throughout the body. Adequate iron levels are crucial for preventing anemia. a condition characterized by low red blood cell count, which can lead to fatigue, weakness, and impaired kidney function. Iron deficiency anemia is common in people with chronic kidney disease, making it important to ensure sufficient iron intake. Good dietary sources of iron include red meat, poultry, fish, beans, lentils, tofu, spinach, fortified cereals, and nuts. The recommended daily intake of iron for adults is around 8 to 18 milligrams, depending on age and gender. If you are taking medicine to treat anemia, you may also need to take an iron pill or have injectable iron. You should only take iron if your healthcare professional prescribes it for you. Number 3, vitamin K2. Vitamin K2 is a fat-soluble vitamin that may help people with chronic kidney disease, prevent and treat cardiovascular disease and bone fractures. Vitamin K2 deficiency is common in chronic kidney disease and can lead to calcium deposition in blood vessels, which can cause cardiovascular disease and skeletal fragility. Vitamin K2 can also help with organ damage caused by hemodialysis. Vitamin K2 activates proteins that move calcium into bones and away from soft tissues. It plays a role in the development of cardiovascular and bone complications in chronic kidney disease patients by catalyzing protein carboxylation in blood vessel walls and bone. Vitamin K2 is found in some foods of animal origin, such as eggs and butter, and in certain fermented foods, such as cheese and natto. However, the conversion of vitamin K1 from food to vitamin K2 is limited. Patients with chronic kidney disease who are treated with renal replacement therapy are especially vulnerable to vitamin K2 deficiency. High-dose dietary supplementation with vitamin K2, in particular menaquinone 7, can reduce circulating levels of inactive matrix G-carboxyglutamic acid protein in patients with end-stage kidney disease. A safe amount of vitamin K2 for most people is around 45 and 50 micrograms per day. However, vitamin K2 may interact with blood thinners. Number 2, vitamin E. Vitamin E, also known as alpha-tocopherol, plays an important role in the kidneys due to its antioxidant properties. Some studies have shown that vitamin E may help prevent or reduce kidney damage, and that higher dietary intake of vitamin E is associated with improved kidney function. For example, a 2023 study found that people in the top tertile of vitamin E intake, 8.770 milligrams per day or higher, had a 14% lower risk of chronic kidney disease than those in the bottom tertile, 5.060 milligrams per day or less. However, high doses of vitamin E can cause adverse effects. People with healthy kidneys can get enough vitamins and minerals by eating a variety of foods from all food groups. However, people with chronic kidney disease or who are on dialysis may need to take supplements to get the vitamins and minerals they need. Number 1, phosphorus. Phosphorus is an important mineral for kidney function and maintaining mineral balance. However, people with early-stage kidney disease or who are on dialysis may need to limit their phosphorus intake. High phosphorus levels can build up in the blood and harm the kidneys, which can increase the risk of kidney failure. High phosphorus levels can also combine with calcium to form dangerous deposits in the blood vessels, lungs, eyes, and heart, which can increase the risk of heart attack, stroke, or death. The recommended dietary allowance of phosphorus is 700 milligrams per day for most adults. However, a kidney dietitian may recommend a daily phosphorus intake between 800 and 1,200 milligrams, depending on your specific needs. Phosphorus is found in most foods, including many healthful foods that are higher in protein, such as meats, poultry, fish, nuts, beans, and dairy products. However, phosphorus is also sometimes added to foods and drinks as a preservative, which is called a phosphorus additive. Dark-colored colas and beers contain high amounts of phosphorus acid, which is added to prevent discoloration and enhance beverage flavor. To manage phosphorus, you can choose natural foods instead of processed foods that have phosphorus added to them. Limit high-protein foods in early stages of chronic kidney disease. Avoid dark-colored colas and beers. You should not restrict dietary phosphorus unless instructed to do so by your kidney doctor or dietitian. Thank you for watching. If you're interested in learning more about how to save your kidneys and other important health topics, click on this next video. Also, don't forget to like, comment, and subscribe to our channel. We would be most grateful.